Have you ever woken up feeling different and couldn't explain exactly why? Or have you noticed small changes in your body that you've ignored because they don't seem important? The truth is that our bodies are constantly sending us signals, and we often don't pay attention. Today, we're going to talk about something that can literally save your life. The 10 silent signs your body gives you when something is wrong. Serious illnesses often start with subtle symptoms that go unnoticed in the chaos of everyday life. This isn't just another health video. It's a wake-up call that can completely change the course of your life. Pay attention until the end, because the last sign is often overlooked and can indicate extremely serious conditions. Who has never ignored a symptom thinking it will pass? We live in a society that values productivity above well-being, where taking time to take care of our health is seen as weakness or exaggeration. We're always too busy, always with more important deadlines, always putting our health off until later. Research shows that 7 out of 10 people ignore worrying symptoms for at least a month before seeking medical help. And do you know what the consequences of this are? Late diagnoses, more complex treatments, and in extreme cases, conditions that could be easily treated become medical emergencies. This culture of neglecting one's own health is silently harming millions of people, and you may be one of them without even realizing it. Before we continue, I want you to do a quick reflection. How many signs has your body given you that you ignored? That persistent headache, the unexplained fatigue, that strange spot. Share in the comments a symptom that you have ignored and what you discovered afterwards. Your stories can help other people recognize important signs. And if you are watching this video because you are worried about a specific symptom, leave your question and we will try to address it in the next content. Now, let's go to the first silent sign that your body may be sending. And believe me, this is much more common than you think. Sign number 1, constant fatigue, that tiredness that doesn't go away even after a good night's sleep isn't normal, no matter how much we try to normalize it. Feeling constantly exhausted can be a sign of a variety of conditions, from anemia and nutritional deficiencies to more serious problems like hypothyroidism, diabetes, or even early-stage cancer. Your body is literally begging for attention when you need 3 cups of coffee just to function, at least minimally. Pathological fatigue differs from normal fatigue in that it doesn't improve with rest and significantly affects your quality of life. If you find yourself saying things like, "I've been tired for as long as I can remember," or "It's just the stress of modern life," it might be time to question those excuses. Sleep medicine experts say that feeling rested upon waking is a fundamental biological right, not a luxury for the privileged few. What to do? If fatigue persists for more than 2 weeks for no apparent reason, see a doctor for basic blood tests, thyroid checks, and hormone levels. Don't self-medicate with energy drinks or supplements without guidance. They can mask important symptoms. Sign number 2, changes in bowel pattern. Your gut is practically a second brain and communicates health problems in a surprisingly effective way if you're paying attention. Changes in the frequency, consistency, or color of your stool that persist for more than 2 weeks can signal anything from simple digestive problems to conditions such as celiac disease, irritable bowel syndrome, inflammatory bowel disease, or, in more serious cases, colorectal cancer. What many people don't know is that about 70% of our immune system is located in the gut. Therefore, changes in the gut can indicate not only digestive problems, but also broader immune imbalances. The gut microbiota influences our health. Mental, to the ability to fight infections. The danger lies in normalizing digestive discomforts as something you've always had, or automatically attributing them to food intolerances without proper investigation. Blood in the stool, for example, should never be ignored. even if it only appears once. What to do? Keep a food diary for 2 weeks, noting digestive symptoms and their relationship to meals. Take this information to your gastroenterologist, who may order specific tests such as fecal calprotectin or a colonoscopy, depending on your symptoms and age. Sign number 3. Skin changes. Our skin is the largest organ in our body and a true warning panel for internal problems. Spots, rashes, or changes that do not disappear within a few weeks can be warning signs that go far beyond aesthetic issues. Yellowish spots on the skin can indicate liver or gallbladder problems. Darkening in areas such as the neck and armpits, acanthosis nigricans, often indicates insulin resistance and pre-diabetes. Lesions that bleed, itch excessively, or change shape may be signs of skin cancer, including the dangerous type of melanoma. Statistics show that early diagnosis of melanoma increases the chances of a cure by more than 90%, while late diagnosis dramatically reduces survival. Another often overlooked connection is between chronic skin conditions and autoimmunity. Conditions such as psoriasis, vitiligo, or patchy hair loss, alopecia areata, can be the first visible signs of a dysregulated immune system, often years before other symptoms appear. What to do? Photograph any worrisome skin changes and monitor changes over time. See a dermatologist annually for a complete checkup, especially if you have a family history of skin problems or skin cancer. Sign number 4. Recurrent headaches. More than just a momentary annoyance, frequent headaches are like alarm bells your brain sets off when something is out of balance. While most headaches are not life-threatening, ignoring them can mean missing important signs of treatable or even serious conditions. Migraines, for example, are not just severe pain. They are a complex neurological condition that increases the risk of stroke, especially in women with migraine with aura who also use hormonal contraceptives and smoke. Headaches that begin after age 50 may indicate temporal arteritis, a vascular inflammation that, if left untreated, can lead to blindness. The pattern of pain also reveals a lot. Morning pain that improves upon standing may indicate intracranial hypertension. Pain that worsens upon lying down may suggest uncontrolled high blood pressure, and sudden intense lightning-like pain requires immediate medical attention for possible brain hemorrhage. What to do? Keep a pain diary recording frequency, intensity, duration, and triggers. If you have more than 10 episodes per month, see a neurologist. Pay special attention to pain, accompanied by symptoms such as double vision, confusion, or stiff neck. These require emergency evaluation. Sign number 5. Unexplained swelling. Waking up with a swollen face or hands may be more than just fluid retention. It could be a sign that your kidneys or heart are sending out a distress call. Edema, the technical name for abnormal fluid buildup, often points to problems in the kidney, heart, or lymphatic systems that need to be investigated. Swelling on one side or limb is particularly worrisome and may indicate deep vein thrombosis. These are blood clots that, if left untreated, can break off and cause a potentially fatal pulmonary embolism. Generalized swelling can signal anything from thyroid problems to more serious conditions such as heart failure or nephrotic syndrome. 1. Less discussed issue is internal swelling. The buildup of fluid in body cavities such as the abdomen, ascites, or the around the lungs, pleural effusion, which can compromise the functioning of the organs even before causing externally visible symptoms. What to do? If the swelling does not go away after a night's sleep, or if it gets progressively worse, seek medical evaluation. Simple tests such as serum albumin, kidney function, and ultrasound can identify the underlying cause. Avoid natural diuretics without medical advice. They can aggravate electrolyte imbalances and mask serious problems. Sign 6. Changes in vision. Your eyes are windows not only to the soul, but also to your overall health. Sudden or gradual visual changes can be the first sign of conditions that go far beyond the need for glasses. Persistent blurry vision, especially after age 40, can indicate undiagnosed or uncontrolled diabetes, with high glucose levels damaging the small blood vessels in the retina. Occasional floating spots are common, but flashes of light or a curtain that appears to cover part of the visual field require urgent attention for possible retinal detachment, an eye emergency. Equally worrisome is sudden loss of peripheral vision, which may indicate acute glaucoma or even an ongoing stroke. An often overlooked sign is a change in color perception, particularly difficulty distinguishing between red and green hues, which can be an early sign of cataracts, optic neuropathy, or age-related macular degeneration. What to do? Don't ignore any visual changes, even if they seem mild or temporary. Annual eye checkups are essential, especially after age 40, or if you have a family history of eye disease, diabetes, or high blood pressure. Remember, many serious eye conditions are asymptomatic until advanced stages. Sign 7. Snoring and breathing problems. During sleep, that snoring that has become a family joke could be a sign of obstructive sleep apnea, a serious condition in which breathing is repeatedly interrupted during rest. In addition to the annoying sound, untreated apnea significantly increases the risk of hypertension, cardiac arrhythmias, stroke, and even dementia. Recent studies show that chronic oxygen deprivation during sleep accelerates cognitive decline and contributes to the development of insulin resistance, which can lead to type 2 diabetes. Another worrying aspect, people with undiagnosed apnea are up to 3 times more likely to suffer car accidents due to daytime sleepiness. Not all snoring is apnea, but warning signs include pauses in breathing, observed by partners, waking up with a feeling of suffocation, morning headache, and extreme fatigue even after a full night's sleep. In children, habitual snoring can affect cognitive and behavioral development. What to do? If you regularly snore loudly or wake up feeling rested, consider a sleep study, polysomnogram. Weight loss, changes in sleeping position, or devices such as CPAP can literally add years to your life when properly treated for apnea. Sign 8. Changes in mood and cognition. Significant changes in mood, behavior, or cognitive ability can indicate much more than just stress or age. Frequent forgetfulness, difficulty finding words, or solving simple problems can be early signs of dementia such as Alzheimer's, especially when they persist or worsen over time. Depressive states that appear after age 50 deserve special attention, as they can be manifestations of neurological diseases such as Parkinson's or cerebrovascular problems. Modern medicine now recognizes that many dementias have a prodromal phase of years or decades when interventions can be most effective. Another critical aspect, sudden cognitive or behavioral changes, especially in the elderly, may indicate urinary tract infections or other treatable medical conditions, not necessarily psychiatric problems. So-called delirium is often the first symptom of serious infections in the elderly. What to do? Don't normalize declines. Cognitive changes as a thing of age. Neuropsychological assessments can detect subtle changes long before they become functional problems. Keep a record of behavioral or cognitive changes and share them with your healthcare provider. Sign 9. Unexplained weight loss. Effortlessly losing weight may seem like a dream come true, but when it happens without any changes in diet or physical activity, it can be a major warning sign. A loss of 5% or more of body weight in 6 to 12 months with no apparent cause deserves careful investigation, as it can be a symptom of conditions such as hypothyroidism, type 1 diabetes, inflammatory bowel disease, cancer, or even tuberculosis. What many people don't realize is that the body has powerful mechanisms for keeping weight stable. Significant weight loss without trying usually means something is interfering with this balance. Particularly concerning is when weight loss is accompanied by other symptoms such as fatigue, bowel changes, or night sweats. Cancers of the pancreas, stomach, and esophagus often cause weight loss before other, more specific symptoms appear, making this a valuable sign for early diagnosis. Unfortunately, many people delay seeking help because they view weight loss as a positive thing. What to do? Document your weight loss, how much and over what period of time, and any other associated symptoms. Seek a full medical evaluation, which usually includes blood tests, thyroid checks, and imaging tests as needed. Sign Lyrica 10, strange sensations in the extremities, tingling, numbness, or shock-like sensations in the hands and feet can be signs of neurological or circulatory problems that deserve attention. Peripheral neuropathy, damage to the nerves in the extremities, is often the first sign of poorly controlled diabetes, but it can also indicate nutritional deficiencies such as B12, autoimmune diseases, or exposure to toxins. When the sensation of numbness or tingling affects only one side of the body or appears suddenly, it may be a warning sign of a stroke or transient ischemic attack, the so-called mini-stroke, requiring immediate medical attention. Burning sensations in the feet, especially at night, may indicate anything from diabetic neuropathy to fungal infections or spinal problems. A worrying aspect is carpal tunnel syndrome, where the median nerve is compressed in the wrist, causing tingling and weakness in the hands. Many attribute these symptoms to excessive use of cell phones or computers, delaying the diagnosis of conditions such as hypothyroidism or rheumatoid arthritis, which may initially manifest in this way. What to do? Do not ignore persistent sensations of numbness or tingling. See a neurologist, especially if there is progressive worsening or asymmetry in the symptoms. Tests such as electroneuromyography can accurately identify the type and severity of the nerve damage. We have reached the end of this journey through the silent signals that your body may be sending you, signals that we often ignore in the whirlwind of everyday life. The knowledge you have acquired today is not just information, it is a tool for self-preservation and care. Remember, your body is constantly communicating with you in a subtle but deeply important language. Modern medicine offers us impressive resources for diagnosis and treatment, but the first step will always be yours, listening to the signals, appreciating the small changes, and seeking help when necessary. Don't let the fear of discovering something serious stop you from investigating. It is precisely early diagnosis that saves lives. If this content was useful to you, help us share this knowledge. Like the video, subscribe to the channel, and turn on notifications for more content that can literally change your life. And don't forget to share in the comments which of these signs you have already experienced or which one caught your attention the most. Your health deserves to be a priority, because without it, nothing else matters. Take care of yourself, and until the next video.